About the Republican replacement plan for the Affordable Care Act. Do you like what you've seen?
I do like what I see. Look, we campaigned on this. We assured the American people that if you put Republicans in charge, we would fix what is in a death spiral. The premiums are going up, I think 25% on average across the board in Arizona. Some of them are as close to 100%. Deductibles have gone up. Choice has gone down. A third, almost 1/3 of the counties in this country have only one choice. And so we've got to save health care in this country for the American people, and they elected us to solve and tackle difficult problems.
Some of the experts who've looked at the Republican replacement plan see problems with it. Here's the Kaiser Foundation, what they say about it yesterday. With Medicaid reductions and smaller tax credits, this bill would clearly result in fewer people insured than under the Affordable Care Act. The House GOP proposal seeks to reduce what the federal government spends on care, and that inevitably means more people uninsured. Does that worry you?
We're always worried, but what we want to do is make sure that people have access to the quality health care that they want. This does push it more out of Washington, D.C. and back to the American people. It does align financial incentives, particularly through the health savings accounts. It does limit and cap what we're doing with the states, but gives them more flexibility, which is what we heard the governors who were in town literally last week. They told us we want more flexibility. So there's a lot to like about this. And you know what I really like about it? We're going to do it in an open and transparent way. Unlike what the Democrats did with the Affordable Care Act, where they slammed it through in less than 24 hours.
Yeah.
It's going to go through a markup. You got 2 committees of jurisdiction that'll offer amendments, and we'll have this debate over the next several weeks.
What if it leaves lower-income Americans uninsured?
Well, we want them to be able to have a method so they can get access to it. There are things that we really do like, for instance, dealing with pre-existing conditions, allowing people up to the age of 26 to stay on that. Yeah, get rid of these arbitrary lines of states.
Sure.
So I think there's a lot of good things that we can do.
But access for lower-income Americans doesn't equal coverage.
Well, we're getting rid of the individual mandate. We're getting rid of those things that people said that they don't want. And you know what? Americans have choices, and they've got to make a choice. And so maybe rather than getting that new iPhone that they just love and they want to go spend hundreds of dollars on that, maybe they should invest in their own health care. They've got to make those decisions themselves.
So, in other words, for lower-income Americans, you're saying that this is going to require some sacrifice on their part.
Well, we got to be able to actually lower the cost of health care. I mean, one of the things we're concerned about is health care inflation is just consuming the American budget, both in the families and at the federal government. We have to be able to drive those cost curves down and provide good quality access. We do think that with more choice, that you will get a better product at a lower price. And that's good for everybody on the entire spectrum of income.
But you're not willing to say that more people won't become uninsured.
Well, we lost, I think it was 4.7 million people or so actually lost the doctor that they had last year. The access is way down. When the cost in deductibles go up, you're not serving the American people well. And we have heard definitively that people know that this is not working. So we're going to try something different. We do think we can expand the coverage so that people have access to a quality health care product that they want.
More access, but possibly less coverage. That might be the byproduct.
Well, yes. Yes, I think that's fair, but we're just now consuming this. So more of the analysis has to happen. That's premature. We just saw the bill as of yesterday. We're just starting to consume it. So we'll have to look at how that analysis moves forward.
Fair enough. Congressman Jason CHAFFETZ, thanks so much.
For having me.